Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Um, Very good evening. I am Dr. Moukoli. I am consultant neurologist practicing in Kolkata. And epilepsy, as you know, it's one of the greatest health burdens on our society in the whole world. Like 50 million, almost 50 million people in India are suffering. So there are some myths, there are some facts, there are some basic understandings. I think every people should have some knowledge about these things so that it can be dealt with effectively.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Actually, seizure is our brain has many electrical impulses continuously being generated inside the neurons. Okay, so when there is sometimes there is a focus inside the neurons from where a burst of electrical impulses are suddenly generated, and that manifests outside in the form of a seizure. So it's an abnormal electrical impulse in the brain which manifests outside in the body as seizure or convulsion, whatever you say.
What is epilepsy?
Yeah, epilepsy is a medical condition. Seizure can occur due to different reasons. Epilepsy is actually a medical condition in which a person getting, if he or she gets two or more unprovoked seizures, then we term it as epilepsy. So
Okay.
It's a disorder in which you are having seizures.
What are the different types of seizures and do they affect people differently?
Yeah, there are many types of seizures. Mainly classifying broadly, we can say there are two basic types: focal seizures and generalized seizures. Focal seizures usually affect a part of the body, either your maybe your hand or your legs, or a part of your face, or your single eye. In the way, part of your body may be affected, and when this seizure spreads in both the cerebral hemispheres, in both sides of the brain, then it is called generalized. So in that way, basically we divide focal and generalized. And generalized again, there are many types of generalized seizure. There may be myoclonus, there may be tonic seizures, there may be atonic seizures, there may be generalized tonic clonic seizures. So these are the different types of generalized seizures. And focal and generalized, these are the basic two types. And obviously they affect people differently. Like if you have like sometimes what people as such know is that the whole body convulses or there is seizing movement in all four legs or all four arms. Sometimes seizure can manifest in the way that sometimes you go blank. A person is there and for few seconds he is going blank, there's a staring look, and then he is okay again. That can be also a seizure. Person they're behaving normally, sometimes there is a behavioral arrest. He or she stops where he what he or she was doing, and after few seconds again comes back to his normal activity. That is also a seizure. A person may say
Okay.
may see stars around the eyes or colored objects for a few seconds, then comes back to normal. That can also be a seizure. May get an feeling of some known acquaintances, like long before he has known something, some uncanny feelings, and then again becomes normal. That can also be a seizure. So different types of seizures may manifest in this way.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Yeah, it can have many causes. Sometimes it is some symptomatic and sometimes it is genetic. Like you have some genetic defects, some genes you are bearing from birth. They manifest as these epileptic seizures or fits once you start growing old, maybe in the second decade or third decade of life. That is your genetic epilepsy. And sometimes there's a some structural causes, like your brain has a tumor, or you have had some brain infection like meningitis, or sometimes in elderly people there is a stroke, or sometimes the brain is damaged due to a stroke or trauma. There is some gliotic changes in the brain. There may be some electrolyte disturbances like fall and fluctuation of sodium levels, so that may also manifest as seizures. So it may be symptomatic. There is some structure, there is a cause behind the seizure, or there may be genetic. You are carrying some defective genes which will give you these seizures.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, caregivers actually these what I was trying to tell ki suppose uh, a, a, a patient is normal, suddenly there is a twitching in the angle of the mouth like this, twitching in the eyes in the form of twitching in the mouth and eyes like this. So the person is getting a seizure. Sometimes the hand or the leg goes stiff. There is a turning of the shoulder towards the affected side. That also is a type of seizure. So whatever, or the whole body is shaking violently. Person is frothing from the mouth. There is urination. There may be defecation. There is loss of consciousness. So these are the broad signs that help to understand the caregiver that the person may is throwing a seizure, and he or she has to manage accordingly.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, actually, from times immemorial, if you go back to history also, initially when people didn't know about all these electrical activities of brain and all this epilepsy term and etc., whenever people, those with epilepsy used to throw seizures, it was thought that they were possessed, or there is some bad power controlling them, some spirits, some this holy thing. So they were they some ghost or some spirits were controlling them. So from times immemorial they have this um, uh, they have attached epilepsy with some sort of myths and all these taboos. So they were outcast from the society. People were, particularly girls, they were not getting married. Their marriage was cancelled because they thought they were possessed, or they were ghostly or something like that. So from times immemorial, they had been looked at a different angle. People uh, don't take this normally. They think that there is something uncanny about these people, so you should be keeping away, and even they are denied treatment. For this reason only, many of the people still they don't seek treatment because of these taboos, and they suffer. And particularly girls, they have a lot of marriage problems. They think that these people cannot conceive. They have these pregnancy issues. So both, irrespective of sex and irrespective of age, people have been these taboos and these myths have been associated with the disease. But with time we have come up with new with the shared knowledge about this disease, and people are now a bit more accustomed that this is a disease and you need to be treated, and you will be absolutely fine if you're on medication. There's nothing, no myth and no spirit, no ghostly thing, and these people are not to be outcasted from the society.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, the common triggers are there. Are some known triggers like for generalized seizures, we say that sleep deprivation, any form of sleep deprivation, any form of stress, any form of your any schedule that is away from normal, that is deviating from normal. You are not normally taking your meals. You are working late. You are not taking your medicines properly. You are skipping doses. You are uh, uh, mainly these sort of things, particularly for generalized seizures. Yes, obviously stress, sleep deprivation, irregular lifestyles, uh, skipping medications, these are mostly the triggers, or any infection as such, fever, etc., can trigger seizures. So these are the basic 4 5 causes that need to be looked out by the patients and the caregivers.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, actually, these people had, whenever you are diagnosing a patient with epilepsy or seizures as such, you should make the patient as well as the caregiver understand that anytime the patient may go into seizure, irrespective of the fact that you are putting him on medication, there may be control of epilepsy, but it may deteriorate. So, the utmost importance is you should take precautions from beforehand, like you are these people are told to avoid open places like terrace. They are avoid to go near fire, avoid to go near open water bodies like swimming pools or ponds, etc., or say, or bike rides, etc., automobiles, cars, whatever. You should have an epilepsy alert with you, so at any time there is an accident or something, people may make out that you are actually having this type of disorders. So these type of lookouts or these type of places are to be avoided, and some, or particularly in your home, you should keep your all these sharp things, the edges of the your doors, windows, walls, etc., needs to be padded up, or you can use also all this protective padding, so that chances of injury or accident is less.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, final thought is that epilepsy is not a taboo or a myth. It is a disease. It's a treatable condition. So anyone, any of your relatives, known ones, near and dear ones, anybody is having symptoms suggestive of seizures, please, please, please consult your physician, consult your neurologist, consult your doctor, so that we can diagnose him and treat him. And an effective treatment can bring a major change in his quality of life, as well as his way of living. So please don't keep it under the taboos, and please feel free to seek treatment, and get treated and take medicines.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.